Welcome to another session of Evidence-Based Natural Remedies by Dr. Khalid Rahman. If you or someone you care about is searching for game-changing, holistic ways to support brain health, especially in the fight against Alzheimer's disease, you're in the right place. Today, we're diving deep into neuroprotection, specifically 11 powerful herbs scientists believe can play a leading role in managing Alzheimer's disease. Grab your favorite drink, settle in, and let's journey through nature's apothecary together. Let me start by asking you, have you ever stood in a kitchen, perhaps holding a piece of turmeric or some sage, and wondered, can these humble ingredients really help protect my brain? If so, you're not alone. I get these questions all the time, and trust me, the science is both surprising and inspiring. Let's begin with the challenges. Alzheimer's disease is on the rise, impacting millions globally. But why are herbs suddenly making headlines in dementia research? Recent studies show that herbal medicines, unlike many pharmaceutical options, can work on multiple pathways at once: antioxidant support, anti-inflammation, even neuroregeneration. This multi-target approach is crucial when we face a disease as complex as Alzheimer's. So what are these herbs, and how do they work? Here's a quick rundown before we explore each one. Turmeric, for its memory-boosting curcumin. Ginkgo biloba, the study-backed brain circulation helper. Ginseng, known for fighting brain fatigue. Bacopa monnieri, cherished for centuries in Ayurveda for cognitive clarity. Ashwagandha, to combat stress and support neuron regeneration. Rosemary and sage, favorites in your kitchen, superstars in your neurons. Cat's claw and lemon balm, for peace of mind and brain health. Gotu kola and huperzine A, rising stars in memory formulas. Which of these have you tried? Do you have family remedies or stories passed down generations? Send them in or leave a voice message. I'd love to feature your questions or tips on future episodes. Stay tuned as we decode how ashwagandha, Withania somnifera, may help slow neurodegeneration, why turmeric's curcumin is on every neurologist's radar, and why getting the right dosage of these herbal heroes truly matters. But let's be clear, power comes with responsibility. Not all herbs are safe for every individual. We'll discuss safety, possible interactions, and answer your top questions about how to start, how much to use, and what to expect. By the end of this series, you'll discover practical recommendations you can bring to your healthcare provider, and hopefully a renewed sense of hope. Alzheimer's may be formidable, but with the right knowledge, a supportive community, and the best of nature and science, we're far from helpless. Don't forget to subscribe, share your thoughts, and check out more evidence-based natural remedies at BioTuber Online by Dr. Khalid Rahman. Stay curious, stay healthy, and remember, every small step counts. Alzheimer's disease is a progressive neurodegenerative disorder that erodes both memory and cognitive function, leaving millions worldwide facing the challenges of gradual behavioral change and dementia. While conventional drugs can sometimes offer symptom relief, there's unfortunately no definitive cure or reliable way to halt disease progression. We're still limited by the predictive power of modern neuroimaging techniques, which often fall short in providing accurate insights into pathological changes. For many, the journey through Alzheimer's means navigating not only memory loss, but also the buildup of amyloid plaques, neurofibrillary tangles, increasing neuroinflammation, and oxidative stress. Living with this diagnosis or caring for a loved one affected by it can be uniquely challenging, especially given the risk of side effects from long-term pharmaceutical use and the uncertainty of future outcomes. Recent research highlights how our traditional medical approaches are not enough and points to a growing need for alternative strategies, including natural and multi-targeted interventions that may offer hope in changing the course of this disease. Modern approaches to diagnosing and managing Alzheimer's disease face serious limitations, as recent research by Perrin and colleagues in 2024 highlights just how inadequate current neuroimaging techniques are at predicting changes within the nervous system of Alzheimer's patients. The gap between what scans suggest and what post-mortem studies actually find makes it clear that there's a pressing need for complementary and alternative options. That's where herbal medicine steps in with compelling advantages. Herbal remedies target multiple disease mechanisms at once, from amyloid accumulation to neuroinflammation and oxidative stress. Not only do these natural therapies generally carry a lower side effect profile than pharmaceuticals, but they're also accessible, affordable, and built on centuries of traditional empirical use around the world. They offer the unique potential for safer long-term preventative care, something that's especially valuable given the chronic lifelong journey of Alzheimer's. Rigorous scientific studies have shown that herbal approaches can deliver neuroprotection and lead to measurable clinical improvements in cognition, making these natural compounds a promising multi-target strategy for those seeking holistic Alzheimer's prevention or management. As research continues to identify bioactive compounds and document their safety, it's increasingly clear that herbal medicine isn't just an alternative. It's a scientifically backed, practical addition to our Alzheimer's toolkit. If you or your loved ones are searching for science-backed natural solutions to support brain health and fight cognitive decline, you're in the right place. Today, we're exploring the 11 Herbs for Alzheimer's, a comprehensive, evidence-based look at botanicals with powerful neuroprotective, anti-inflammatory, and cognitive-enhancing properties. Each of these herbs has been studied not just for memory support, but also for their ability to protect nerve cells and combat the complex pathways behind Alzheimer's disease. This isn't about quick fixes, but holistic, natural remedies grounded in clinical research and centuries of experience. Whether you're curious about how nature's medicine cabinet can help prevent dementia or want to know which bioactive compounds truly make a difference, we'll cover it all. Hippocrates famously said, "Nature itself is the best physician," and modern science is catching up, with peer-reviewed studies now confirming the neuroprotective promise of these time-honored herbs. Get ready to discover which plants stand out in the fight for better brain health and how you might integrate them into a holistic Alzheimer's prevention strategy. Stay tuned for actionable insights, practical usage tips, and the latest research on nature's most compelling answers to Alzheimer's disease. Turmeric, often called the golden spice, is a standout natural ally in Alzheimer's prevention and brain health. Its bioactive compound, curcumin, has grabbed the spotlight for powerful anti-inflammatory, antioxidant, and neuroprotective effects, and traditional medicine across South Asia has leaned on it for centuries. Science has now caught up, revealing that curcumin helps reduce beta-amyloid plaque formation, a core feature of Alzheimer's, while also decreasing neuroinflammation and neutralizing oxidative damage. What makes curcumin truly unique is its ability to cross the blood-brain barrier, binding directly to beta-amyloid to inhibit its aggregation and encourage disaggregation of existing plaques. As a result, it actively protects brain cells from damage, boosts neurogenesis, enhances the clearance of amyloid, and reduces inflammation all at once. For maximum efficacy, health experts often recommend 500 to 2,000 milligrams of standardized turmeric extract with at least 95% curcuminoids per day, ideally alongside black pepper, piperine, and healthy fats to optimize absorption. If you are taking blood thinners, consider talking to your physician before supplementing. While the scientific evidence supporting these benefits is moderate to strong and continues to grow, turmeric remains one of the safest, most accessible natural therapies for long-term cognitive wellness and Alzheimer's risk reduction. Ginkgo biloba stands out as an ancient memory enhancer that's backed by both history and scientific research, making it one of the most popular herbs for cognitive health and Alzheimer's support worldwide. Dating back more than 290 million years, ginkgo is not just a living fossil, but also a centerpiece of traditional Chinese medicine. Its remarkable benefits for brain health stem from a powerful combination of flavonoids and terpenoids, which serve as antioxidants to neutralize damaging free radicals, as well as unique ginkgolides and bilobalides that help improve blood flow and oxygen to the brain. Research consistently shows that ginkgo can reduce beta-amyloid plaque accumulation, inhibit neuroinflammation, and counteract oxidative stress, factors closely linked to Alzheimer's disease progression. Multiple studies even suggest that ginkgo's effectiveness rivals that of prescription cholinesterase inhibitors for treating mild to moderate Alzheimer's symptoms. For best results, experts recommend 120 to 240 milligrams of standardized ginkgo extract daily, ensuring at least 24% flavonoid glycosides and 6% terpene lactones, with the full benefits typically appearing after 4 to 6 weeks of consistent use. Remember, ginkgo may interact with blood thinners or antiplatelet medications, so consulting a healthcare provider before starting supplementation is wise. For anyone seeking natural and evidence-based ways to promote memory, slow cognitive decline, or enhance overall brain function, Ginkgo biloba remains a scientifically supported, time-tested solution. Panax ginseng, often known as Korean or Asian ginseng, is a time-honored remedy celebrated for its all-healing properties, including cognitive support. This ancient root contains potent active compounds called ginsenosides, which can cross the blood-brain barrier and deliver neuroprotective effects directly to brain cells. Scientific research shows that ginseng helps reduce beta-amyloid plaque accumulation, which is a key pathological feature of Alzheimer's disease. In addition, it enhances neurotransmitter activity, especially acetylcholine, while decreasing inflammation and oxidative stress, both of which significantly contribute to cognitive decline. Ginseng also promotes neuronal survival and synaptic plasticity, allowing the brain to maintain its adaptability and function longer. Clinically, multiple studies report improvements in cognitive scores and working memory among Alzheimer's patients supplemented with standardized ginseng extracts. For best results, the recommended dosage is typically 200 to 400 milligrams daily, with long-term use over 3 months or more showing the most benefit. As with other natural interventions, caution is advised for those on blood thinners. With its blend of tradition and scientifically validated benefits, Panax ginseng is emerging as a key herbal ally in the ongoing fight against Alzheimer's disease. Bacopa manieri, also known as Brahmi in Ayurvedic medicine, is a celebrated herb for enhancing memory, learning, and overall cognitive function, and its benefits now reach far beyond India to wellness communities across the globe. What truly sets Bacopa apart is its rich concentration of bacicides, the bioactive compounds credited with not only protecting neurons, but also boosting nerve impulse transmission and increasing vital acetylcholine levels in the brain, a neurotransmitter essential for memory and learning. Modern research has shown that Bacopa can reduce harmful beta-amyloid deposits, support powerful antioxidant and anti-inflammatory actions, and ultimately fend off both the root causes and symptoms of cognitive decline. For those keen to improve memory acquisition, information retention, and delay cognitive aging, Bacopa's neuroprotective effects are well documented. Best results are achieved with a typical standardized dose of 300 to 600 milligrams per day, but it's important to note that Bacopa works gradually. Full cognitive benefits often appear only after 8 to 12 weeks of consistent use. Studies particularly highlight its ability to enhance cognitive function in elderly populations and suggest that it may slow early decline in Alzheimer's disease, making it a central component of any natural, evidence-based brain health strategy. Ashwagandha, often called the Indian ginseng, is a time-tested adaptogenic herb that's been central to Ayurvedic medicine for more than 3 millennia. Revered for its ability to help the body adapt to stress, ashwagandha is now at the forefront of natural cognitive support and Alzheimer's prevention research. The herb's most potent benefits come from withanolides, bioactive compounds that cross into the brain and offer robust neuroprotection. Ashwagandha works on several key fronts. It inhibits beta-amyloid buildup and formation of toxic protein aggregates, shields neurons from oxidative damage with strong antioxidant effects, and decreases neuroinflammation thanks to its anti-inflammatory properties. Importantly, emerging studies suggest ashwagandha may even support the growth and regeneration of nerve cell dendrites, paving the way for improved cognitive and psychomotor performance. Clinical evidence reveals that supplementation with standardized extracts, 2.5 to 5% withanolides, 300 to 500 milligrams daily, can enhance memory formation and recall while being generally well tolerated with few side effects. For those seeking natural approaches to protect brain health, reverse memory impairment, and combat neurodegeneration, ashwagandha stands as a powerful and well-researched ally, though, as always, consulting a healthcare provider is wise if you're pregnant or taking other medications. Rosemary and sage aren't just flavorful additions to our favorite dishes. They're powerful brain boosters backed by both tradition and modern science. These aromatic herbs have a long history in medicine for supporting memory and cognition, and it turns out that their benefits are more than folklore. Rich in carcinic acid and rosmarinic acid, rosemary and sage deliver strong antioxidant and anti-inflammatory effects that protect neurons against oxidative stress and reduce neuroinflammation, 2 major drivers of cognitive decline and Alzheimer's disease. Essential oils like 1,8-cineol in rosemary help sharpen cognition, while the flavonoids in both herbs work to support brain health at a cellular level. What really sets these herbs apart is their demonstrated ability to inhibit acetylcholinesterase, the enzyme that breaks down acetylcholine, our brain's most vital neurotransmitter for learning and memory. By increasing available acetylcholine, rosemary and sage can meaningfully enhance memory, focus, and information retention. Compounds like di-CCA derived from these plants have even shown unique promise in the fight against Alzheimer's. You can use rosemary and sage as extracts, 750 milligrams daily for rosemary and 300 to 600 milligrams for sage, or even enjoy them as herbal teas or aromatherapy for mild, sustained support. For anyone looking for safe, accessible, and evidence-based ways to promote brain health, sharpen recall, and delay cognitive aging, these time-honored herbs offer a potent and delicious strategy. It's always best to check for medication interactions with your healthcare provider, but rosemary and sage stand tall as scientifically proven natural allies for memory, learning, and holistic brain vitality.
Gotu kola, or Centella asiatica, is a revered traditional herb from Ayurvedic and Chinese medicine, celebrated for its ability to boost cognitive function, memory, and neural repair. Packed with triterpenes like asiaticoside and medacoside, Gotu kola enhances cerebral microcirculation, supports the growth of new dendrites, and helps the brain fend off oxidative stress, making it a go-to remedy for anyone seeking to preserve brain power as they age. Multiple studies confirm that standardized Gotu kola extract, 500 to 750 milligrams daily, can improve cognition and memory, especially in older adults or those with cognitive challenges. Equally impressive is huperzine A, a natural alkaloid derived from Chinese club moss. Acting as a reversible acetylcholinesterase inhibitor, huperzine A stops the breakdown of acetylcholine, the neurotransmitter essential for memory and learning. Clinical research shows that 50 to 200 micrograms of huperzine A per day, split into 2 doses, can protect brain cells from glutamate-induced damage, reduce inflammation, boost nerve growth factor, and even improve daily living for Alzheimer's patients. Both Gotu kola and huperzine A offer significant neuroprotective benefits through different mechanisms to make them a dynamic duo for any Alzheimer's prevention strategy. Their combined actions help repair and rejuvenate brain cells, improve memory retention, and slow cognitive decline, establishing these two botanicals as evidence-based, highly promising additions to natural brain health regimens. When it comes to supporting brain health and reducing the risk of Alzheimer's, the smartest approach is to combine the best of both worlds, herbal remedies and conventional medical treatment. Don't see herbs as replacements, but as powerful complements to mainstream therapies that can target inflammation, oxidative stress, and beta amyloid buildup from multiple angles. For safety and best results, always start with one herb at a lower dose and gradually increase as tolerated. And be sure to consult your healthcare provider, especially if you're on blood thinners or sedatives. To get the most out of your regimen, standardized extracts ensure potency and reliable benefits, while pairing your herbal protocol with lifestyle changes like a Mediterranean diet, regular physical activity, and consistent cognitive stimulation maximizes protection. The evidence shows that early, proactive intervention with neuroprotective herbs offers the greatest promise. But prevention is still more effective than treatment, especially for those with a family history of dementia or Alzheimer's. As ongoing research continues to expand our understanding of natural compounds, the key takeaway is that herbal interventions bring multi-targeted, safe, and accessible solutions that can make a real difference in brain health for the long term. If you're looking to protect memory and maintain cognitive function as you age, incorporating standardized, well-researched herbal remedies under professional guidance might be one of the most practical, science-based commitments you'll ever make to your brain's future. This presentation is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider or physician before making any decisions related to your health or starting any new treatment or supplement regimen. The information shared here is intended to support your knowledge and understanding, but does not replace personalized medical guidance tailored to your individual needs. Ready to transform your knowledge and health? Hit that subscribe button and join BioTuber Online for the best in science, health, and wellness insights. Stay ahead with breakthrough updates on medicine, Alzheimer's prevention, cognitive health strategies, and evidence-based wellness advice, delivered by health advocate, health scientist, and scholarly communicator, Dr. Khalid Rahman. This channel provides the latest research, actionable tips, and practical guidance for optimizing various aspects of health, including brain health and overall well-being. Don't miss out. Subscribe and click the bell for instant alerts on every new episode. Find us easily at youtube.com/biotuberonline. Join a trusted science and health community today. Your journey to smarter, healthier living starts now. Subscribe for research-backed content that empowers both your mind and body.